Dr. Matt Wolf, who just joined the UVA Heart and Vascular Center, joins us for today's house call. He heads up the Wolf Lab, where work is being done to help discover the genetic cause of cardiomyopathy. Let's start by talking a little bit about the condition itself.
Sure. So cardiomyopathies are a disease that affects the heart muscle, and it can cause the heart to become enlarged, not contract very well or weak, and in some cases can cause the heart to become thickened so that the muscle doesn't relax well.
All right, so we talk about what it is. Let's talk about some of the common symptoms that we're looking for.
Sure. So in early stages, it can be asymptomatic. Individuals may not have any symptoms, but as this disease progresses, you can develop really significant symptoms consistent with heart failure, and that would be shortness of breath at rest that can oftentimes also occur with exertion. You can notice swelling in your ankles or fluid retention in your abdomen, lightheadedness, dizziness, palpitations, and even passing out.
And now some of these are symptoms that don't necessarily correlate. I mean, are relatively common for a lot of things.
That's right. So it oftentimes takes very careful clinical history taking and a lot of thought to try and understand if a cardiomyopathy is responsible for those types of symptoms.
All right, so we get beyond the kind of the simple what if. You have something a little more serious with advanced work. Talk about the role genetics can play in all of this.
Sure. So at UVA, we are fortunate to have a multidisciplinary team that consists of cardiologists, genetic counselors, and nurses who see patients who may have heart diseases that run in their family, take very detailed family histories, perform some diagnostic screening tests, and have the opportunity to provide some genetic tests that are as simple as drawing some blood to try and identify genes or gene variants that could cause disease, and those variants could potentially be inherited by other family members who may be at risk of developing disease before symptoms actually develop.
And is kind of the family aspect of it relatively new? It seems like, genetics often plays a role in disease.
I would say the family aspect is probably the most important part of diagnosing this. In fact, it's oftentimes when multiple family members start to develop the same type of disease that makes individuals and cardiologists and genetic counselors concerned that there's some familial component or a genetic component that's responsible.
All right, Dr. Matt Wolf, appreciate your time tonight. Thank you so much.